Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to continue with our series on pain management after knee replacement surgery, and we're going to talk specifically about modalities. So what are modalities? Modalities are really, for my definition, is any type of physical agent or thing you put on your body. So things like heat, ice, ultrasound, electrical stimulation, laser treatment, things of that nature. Those are what we would call modalities, at least in our physical therapy sphere. So what are some of the modalities and things that you would use for pain management after having a knee replacement? Well, the big one is going to be ice. Of course, I'm sure you've probably heard about this by now, no matter where you are in your knee replacement journey, that icing is really common and extremely recommended after knee replacement surgery. Now, the traditional thought is the reason to use ice is to help with swelling and help with recovery and healing. And has started to be a debate out there, I'll say, about the benefits of ice and how beneficial it actually is. Does it improve recovery? Does it improve swelling? Does it improve these things like we think it does? And I think that more and more that we're starting to question that theory and that thought process. But definitely from a clinical perspective and from working with people after knee replacement surgery, I think the big benefit of icing is for helping with pain relief. So people after doing their exercises or people early on in the knee replacement, the recovery process, those first days, that first week or so after surgery, I think icing can be very helpful and very beneficial for helping to decrease the sensitivity of the knee, decrease pain and discomfort in that area. And I think it may also help to some extent with the swelling. Now, again, we don't know exactly how significantly, but I think managing that swelling can be very helpful in terms of, one, just being able to tolerate different activities, tolerate some bending and straightening of the knee, but also for pain relief as well. So that being said, moving from ice, I want to talk about these things that you probably hear when people talk about RICE, so rest, ice, compression, elevation. So let's talk about compression. So compression, of course, again, the goal is to manage some of that swelling in the leg. So using maybe like an ACE wrap, some people, their doctors prescribe these TED stockings or other compression stockings after surgery. And a lot of it is just the goal of managing the swelling. Now, there's a lot of important reasons to make sure the swelling is under control. Swelling isn't necessarily something evil, something that we have to fear. It's a normal part and a normal process of the healing and recovery process for your body, but it is something that we want to make sure it's at a manageable level. And one of those big reasons is to help prevent blood clots, especially early on after surgery, but also I think it provides some pain relief and just ability to tolerate things a little bit better. So using compression, I think, is another very useful option. And what I like to do is combine that usually with elevation. Now, elevation is, a lot of people don't get the full benefit of it because you really have to have that leg up pretty high. So I've heard, a 45-degree angle up above the heart for you to really get those benefits. And you have to keep it up there for a pretty decent amount of time, not just, a minute or 5 minutes, a good 10, 15 minutes at the minimum. And so I like to do that. If people like to use these techniques, I would recommend doing some compression, so maybe wrapping the knee or wearing a compression garment or stocking, and then elevating the legs, so laying down on a flat surface and stacking it up with pillows or a bolster or whatever you have available to really get that leg up high in the air to manage that swelling effectively. Now, I will say, if you're someone who has any type of cardiac issues, just make sure you double check with your doctor, double check with a surgeon that it's okay to do that. You don't want to overwhelm the heart and the pumping of the heart with too much fluid and too much blood flow coming back toward the heart. So just double check anything with kind of managing swelling, elevation, compression, double check that with your doctor. So those are the big ones with managing swelling, which I think in turn helps with managing pain management. So the icing, you're going to ice machine is probably going to be your best friend, especially those first few weeks. Then the compression and also the elevation can be very helpful. Now, what are some other modalities? Well, there's heat. So a lot of people talk about, should I use heat? Should I use ice? Should I use one or the other? I say use whichever one helps you feel better. Early on, you probably want to use the ice a little bit more, again, just because we're managing that inflammation and swelling. But as you progress in your rehab, if you find the heat to really be helpful and help relax the muscles and relax everything, then it's perfectly all right to use some heat on your knee. I like to use it sometimes before doing physical therapy or before doing range of motion exercises with patients, just to kind of relax everything, decrease some of that pain and discomfort. So heat is perfectly okay to use. Early on, I would focus more on the ice if you are going to use one or the other. And then maybe after a week or a few weeks out from surgery, then you can start to incorporate the heat a little bit more, kind of on a as needed basis, or if you have maybe before doing your exercises, just to help to calm everything down a little bit. And then also probably the biggest one is going to be electrical stimulation. So we have what's called TENS, which stands for transcutaneous electrical nerve stimulation. And this is basically a way to provide pain relief. So it provides this electrical stimulation, kind of this pins and needles, tingling sensation in and around the knee through these electrodes, these little sticky pads that are put on the knee or around the knee and attached to the machine. TENS is widely used. It can be really beneficial just to help manage pain and discomfort and just tolerate your day-to-day tasks a little bit easier. So I'm all for using TENS as long as it's used appropriately. It has very low risks in my opinion. And then there's also what we call neuromuscular electrical stimulation. So using that electrical stimulation to actually try to get a muscle contraction. Usually, most commonly, you see that with the quadriceps, so those big muscles of your thigh that are atrophied and weak after surgery. So using that to stimulate the nerves, which in turn cause a contraction of that muscle. So that's another way you see that as well. So that's probably the most common ones. There's also things out there. There's laser, there's ultrasound. There's probably other ones that I'm not even thinking of right now. But these are probably the core things that you will see to help with managing pain, managing discomfort, managing swelling after your knee replacement surgery. So if you're someone who is somewhere in that knee replacement journey, I'd love to hear your comments. Did you use any of these different modalities? Which did you find most beneficial? Which did you not find that beneficial? Any other recommendations you would give to people? I'd love to hear it in the comments. Please be sure to leave a like if you found some useful information from this video. And as always, please be sure to subscribe if you want to catch all our videos related to knee replacement surgery, exercises, recovery, rehab, frequently asked questions, everything else in between. Thank you very much for watching.